Hello everyone, it's Mike Lister from the city of Anaheim, and this is your coronavirus video briefing for Wednesday, May 20th. It has been a mild start to the week in terms of cases. We've only seen 6 cases on Monday, 6 additional cases on Tuesday, for a current running total of 707 for the city of Anaheim. Now, of course, that will change when we get updated numbers midday today, and if prior weeks are any indication, we could see a pickup in the number of cases we see later in the week. Now, again on cases, when you hear us talk about some 700 plus cases, these are cumulative cases since counting began, really going back to late February and early March. They do not represent 700 plus active cases in our city now. The number of active cases in our city is actually much smaller. We do not have a precise number from that, but we know that the vast majority of people do go on to recover, thankfully. So the number of active cases at any given time in our city is actually very, very small. Now, sadly, in our city, we are aware of 9 deaths since the coronavirus crisis started. Now, 7 of those are at skilled nursing facilities, which I'll talk about a little bit more in just a moment, and 2 are among the general population. While every death in our city is tragic, that is actually a very low number given the crisis we face, and follows a very low death rate for Orange County as a whole, which is about 2%. Now, a little bit about testing. We've actually seen very low testing reporting the past few days. Now, that can always be revised upward. We are not quite sure why. You can see fluctuations with providers in terms of them providing reports to the county. But we've also heard from the county that it could be lower demand in general for testing. Now, if that bears out to be true, that certainly would be a positive thing. That is, less people with symptoms, less people feeling they need to be tested. But we will have to see and determine if that trend holds. Now, of course, we continue to expand testing. Here in Anaheim, we have 2 sites available. One is Ultimate on Anaheim Boulevard in the 91 freeway for general testing. Anyone in our city can go there and be screened to have a test done. Now, it's not guaranteed that you'll be tested, but if you meet priority and criteria, high likelihood you will be tested, and even if you can't afford it, testing will be provided. Now, we have a second provider in our city, Golden West on Anaheim Boulevard, just north of Ball Road, where they are providing screening for employees. They are providing both confirmation swab testing, is someone infected now, as well as antibody testing, and that is really what they are focused on to see if somebody's had it before, and they are really focused on employees going back to work. So keep that in mind for Golden West. If you have symptoms, you want to call your primary healthcare provider. Golden West is really looking just to provide that secondary testing for somebody looking to go back to work. Now, you can see all the details here on our website in the Access to Testing tab that we have. And another note here in Orange County is that of the some 80,000 tests that have been done, we have a 5% positive rate, meaning 5% of all those tests are coming back positive. That is actually very, very low. It has dropped down from 8, from 7, from 6. We are now at 5. That is much lower than other regions, and we will take that as a very encouraging sign that as the amount of tests done grow, the rate of those testing positive actually is going down. Now, to address skilled nursing facilities, they remain a challenge. We have about 30 in our city. We check on them every day, and there's about 3 or 4 where we know there are issues that are being worked through. But there are signs of stabilization and some encouraging signs as well. At anaheim.net/coronavirus, we will now be breaking down more detailed information about the skilled nursing facilities that we're watching. We are going to be sharing with you active cases, the number of folks that have recovered, of course, any deaths that we may see, but rather than just a running cumulative total of cases at any one given facility, we will share with you how many active cases there are, how many folks have recovered. And the encouraging thing is is that even with this vulnerable population, people are recovering. And that is a fantastic thing. It is a sign that we are getting on top of this situation. Now, we'll continue to see more cases because skilled nursing facilities are a challenge, but we are seeing many, many encouraging signs of stabilization, and also staff almost universally where we see cases, they do go on to recover as well. We'll be sharing that information on the website as well. And then switching to reopening, which is really the issue of the moment. From where we stand today, nothing is different today than yesterday. We are in the early phases of stage 2 of California's 4-stage reopening plan. But what has changed is California has provided eased guidelines for counties to meet and then to move quickly through both stage 2 and then on to stage 3 and eventually stage 4. So where we are, the County of Orange is currently working on a plan as we speak. We could see a submittal to the state of California of this plan within days, and if it is approved, we here in Anaheim and all of Orange County would be able to advance further into stage 2, which would mean more stores opening up, potential in-store shopping, some dining at restaurants with a lot of limitations. That would be the advanced later stages of stage 2. But more important is moving deeper into stage 2 allows us to get to stage 3. Stage 3 is critical. It would allow for religious gatherings, for salons, for sports without fans, and we are seeing movement on baseball in our city. And it of course would also allow for phases of the Anaheim resort. Now let me stop and talk real quick about Disneyland. Today, Wednesday, May 20th, we are seeing the opening of Disney Springs, which is the equivalent of downtown Disney in Florida. That's critical because we are watching first the reopening of the park in Shanghai, and then now the reopening of shopping in Florida, with presumably the parks in Florida to follow soon. This is all a blueprint for us as we look to eventually opening very cautiously the shopping of downtown Disney, hotels in the Anaheim resort, and then of course getting to some sort of phased plan with our theme parks. Now this is critical because we know so much of our economy is indeed driven by the theme parks and the Anaheim resort in general. So we are very closely watching this, and that is why moving through these phases are critical. The County of Orange, our best case scenario, perhaps we might see some sort of input from the state with some sort of easing further into stage 2 by as early as this weekend. But to manage expectations, we just don't know what the state is going to say. So if it is not by this weekend, it could be by next week and really in coming days. So stay tuned for that. That will bring more flexibility for businesses and help us push to stage 3, where we know many more things would be opening. Now, what we need all businesses to do is to get ready for reopening if they have not opened already, or if they're not getting ready already. So all businesses are going to have to meet changes and new guidelines. You've got to allow for spacing among employees, 6 feet or more. You're going to have folks at workplaces wear masks and face coverings, stepped up disinfecting of spaces, and all of these things that we know are the new reality for businesses here. Now, what was most critical is that you really need to track sick employees. In the old days, if an employee went home sick, we would say, see you in a couple days, we hope you feel better. Now we've got to check back with that employee. We've got to monitor for any symptoms of coronavirus. And then if you were to see a case, you've got to quickly be able to jump on that and trace and track any contact that employee may have had. This is probably the most critical thing that businesses will need to do going forward, because we don't want to take a step forward and then 2 steps back. And 2 steps back would be 1, 2, 3 employees at any workplace coming down with COVID-19. So that is a critical responsibility going forward. Now, of course, all of this is new, so we have a site to help businesses through this. It is anaheim.net/reopening. We provide those 4 stages of California's reopening at a glance, where you can see what's open previously from stage 1, what is open now in stage 2, what comes later in stage 2, and of course stages 3 and 4, where we will really see more businesses opening. Now, we also provide a summary of California's guidance for reopening businesses, as well as industry-specific guidance for construction, real estate, retail, and many other industries. Now, we know for many businesses this is new territory, and everybody needs a plan, a written plan to reopen with. And if you don't know where to start, we have a downloadable template that you can use from anaheim.net/reopening as your starting point. All of the key criteria are outlined, and some of what California is looking for is outlined there. Really, you just need to fill it out for your workplace, make it your own. Now, switching to our parks, we get a lot of questions. When are our dog parks going to open? We have already opened tennis courts, golf courses, and pickleball courts. And we are working towards opening dog parks, skate parks, and picnic areas of our parks in coming weeks, but we are not quite there yet. Why they are different is that we can see significant gatherings of people in all 3 of those. We have to figure out a good plan, but we would imagine that will be a matter of weeks. Certainly by the time we get to stage 3, we think our dog parks will be open, but if we can phase it in sooner, we will certainly do so. So please keep following us for updates. Now, going forward, to wrap up, we are going to see more cases as more businesses open and more public spaces open. That is not necessarily because of reopening, but because we are going to continue to test. We are going to continue to find more cases. Now, what we look for with reopening is what I referred to earlier. 3 or 4 cases that we can trace to a particular location. That is how we know we will have an issue with any particular business, industry, or a public space, and then we will jump on that and address it. But everybody else, we need to keep doing what we are doing. You know, get out and enjoy it a little bit more, but we still have to stay home as much as possible. We have to keep 6 feet from others outside our immediate household. We've got to continue to use face coverings, we've got to keep our hands clean, and we've got to do all these best practices. For us to keep moving forward really takes us to continue these best practices that we've learned over the past 2+ months and continue those going forward, because reopening will look a lot like what going to the grocery store has looked like for the past 8 or 9 weeks. Very different from what it used to be, but with a lot of precautions and us taking a lot of precautions as well. So thank you. We had a lot of ground to cover today. Keep following us at anaheim.net/coronavirus. We are making progress through this. We are in it together and we will get through it together. Thank you, Anaheim.